Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hi, Nita. I'm laughing already because I'm looking over all these jokes that my patients send me, and they're so corny.
Oh, my goodness. Well, before we do jokes, why don't we invite people into the conversation?
I would love it. Here's how I'm going to do it. I'd love you to call me right now live. You can talk to me about your musculoskeletal problems, orthopedic issues, arthritis, neck pain, back pain, finger pain, shoulders, hips, toes, doesn't matter. I inject the entire body with regenerative medicine. That's a new type of medicine, new to a lot of you, not new to me. I've been doing this since about 1997 when I was a resident at UCLA in my training. And guess who the guinea pig was? Me. No one really taught me this stuff. It's something that worked on me, and I've been using it on my body for over 25 years. And people say, why do you have to keep using it? Because I'm an athlete idiot, like a lot of you. I'm 74, but I'm still cranking hard. As the older I get, the more my wife says, would you stop beating yourself up? And I go, I can't help it. I'm only 16. And I love stressing my body out, exercising, running as fast as I can, lifting weights, hitting the golf ball as far as I can. It doesn't matter. Whatever I do, I tend to do it in excess, just like a lot of you folks listening. So if you have any of those kind of injuries, or if you have arthritis anywhere in your body, call me right now. The phone number to the studio, I love my callers. It's 866-870-5752. That's 866-870-5752. I hope you're not shy. If you are, you can call you can actually look at the website on just on the internet. And that has a spot where you can email me. And that's www.lastemcells.com, www.lastemcells.com. If you want to call the office, there's people there that can pick up. And the number there is 800-300-9300, 800-300-9300. But give me a call right now. Let's have some fun. If not, I'm going to torture Anita with some dumb jokes. And the number to call us right now is 866-870-5752. Besides doing musculoskeletal medicine, we also take care of cosmetics on the face by injecting the same type of cells, stem cells and or platelets into the face, just like I do it on the joints, ligaments, and tendons. And it can be done for hair regeneration. If your hair is thinning, we can wake up those follicles and thicken up the hair too. Nita, you got anything you want to add before I move on?
Yeah, right before we go to Tom, I just want callers to know that when you phone the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, with over 264 scientific studies. So that's what's going on, and we'll go to Tom in L.A.
Hey, Tom, thanks for calling. We're going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. How many studies, Nita? 265?
264.
I laugh about that because I've always lectured about regenerative medicine to hospitals and doctors back for more than 20 years. I've taught at UCLA for more than that. And there's always a couple of orthopedic surgeons that stand up and go, where's the research? So I took 5 years out of my life. I was working full time, but at night and weekends, I'd be writing this book, gathering all the studies that they wanted to see, which show that regenerative medicine does work, and why surgery is often a very bad thing to do to your body because of the bad outcomes that we see. Not always, but it's a gamble, and it's a non-conservative gamble. I have a lot of people that have gotten hurt pretty bad from surgeries, and I've actually seen a couple people die on the table. One lady had a heart attack from the anesthesia. We get a lot of people that come in that have been infected after surgery. So I'm not telling you not to get a surgery. I'm just telling you the reality of it. And the work that I do is pretty simple. You walk in, get injected, and walk out. So, Tom, you've got a hip issue. How long has that been bothering you for?
I was hit by a car as a kid, and I had this, I guess a syndrome, I'd call it, like a tension up through my body.
Yep.
And I had pulled a groin muscle in college. So I only knew that when I would lay on my stomach and lift up my left leg, I would feel some type of relief right up through my sinuses. But then I discovered my left leg is at an angle.
Sure.
It doesn't go down level like my right leg.
Okay.
And now when I push it in my old age here, I'm 62, I get so much relief by forcing that left leg down and stressing it a little bit.
Okay.
And I go, it must be connected to getting hit by the car when I was, young.
It might be, but it's not really relevant. What's relevant is you have it. Every patient comes in, they go, Mark, why do I have this? I had this happen to me, I had this happen to me. I go, who cares? What matters is that you have it. And when I examine people, I can tell them literally in a minute or so if I can help them with regenerative medicine using platelets and or stem cells. So that's the good thing about it. And have you listened to the show before, Tom?
No, I stumbled into it this morning, and I was so happy to hear what I was hearing.
Okay, good. So I talk about this on every show because it's so important. Most of the people that I see bring in MRIs or X-rays or CT scans, and they tell me what their diagnosis is, and then I examine them and I say, your pain generator is not in your MRI or X-ray. It's not in your image. It's in my hands, and the doctors are wrong. I'm not saying every doctor is wrong or every image is wrong, but frequently they are. So we have to be very careful. There are studies that show that people that have no pain at all have terrible things in their body when you look on images. So I hope this is getting clear to you. Did you ever get any images done, or did any doctor give you a diagnosis?
I've lived with this tension issue my whole life. I dated a lady who was a nurse practitioner. 1990, she got me into the USC Women's Hospital just to get a free MRI.
Okay.
And unfortunately, at the time, I thought I might have a deviated septum because I said I'm going to dedicate myself to medical science because my condition radiates up into my jaw and nose.
Okay, that's possible.
When
sure.
I stretch the left leg, I get this relief, which is unbelievable.
Okay. Well, you're the guy that I definitely would have to examine and use my hands to find out where that point is that's the issue. And if we can find that, which we normally can do, then the injections that I do with regenerative medicine of platelets and stem cells can often help get rid of the problem. You haven't
appreciate your thoughts.
You haven't been to a doctor at all about this?
Not in my consciousness of what the issue is only graduating in my old age here. I literally could not figure it out before. I thought it was nose or something.
Yeah.
Even deep tissue massage, I'd leave the place feeling fabulous, and then a half an hour later it would just creep back.
Okay. But you have not been to you haven't been to a medical doctor yet to find out anything?
No. Okay,
very good. I was just checking to see what anyone else had to say about it. So if you want to come in, the number to the office is 800-300-9300, and you can. We're going to send you a free copy of this book that I wrote, Stem Cell and Platelet Therapy: Regenerate, Don't Operate. You'll get a lot of information from there about what this work is about, and if you think it applies to you. You can also go, Tom, to the website, www.lastemcells.com, and you can do that right now. And there's a lot of videos of me doing these procedures, and you can see if you think that you're a candidate. If you come in and I examine you, I can tell you in a couple minutes if you're a candidate, okay? Just by touching you and moving the body around and seeing what this syndrome is all about.
Okay, I appreciate that.
Well, I appreciate your call.
Okay. Have a great day.
You too. God bless you, man. I appreciate it, Tom.
Thank you, Tom.
So give me a call, folks. I love this one that Tom had. It's a real strange one, but hopefully we can get to the bottom of it. Give me a call right now at 866-870-5752. I'll repeat it while you grab your pens. 866-870-5752. Let's see if we can help you with your musculoskeletal pain. That's pain, orthopedic style, and see if we can help you save away and not have to do a surgery when it's not necessary. And as you folks who listen to me all the time know, in my opinion, and I'm just one guy, most people don't need musculoskeletal or orthopedic surgeries. You do if you have a broken bone, it's sticking out of the skin, there's no question about it. But things like meniscal tears, rotator cuff tears, labral tears in the hips, all these things, and arthritis all over, I don't think surgery is a great idea. I'm sorry. Don't get mad at me. It's my opinion based on a lot of years of doing this work. And I see way too many people come in after they've suffered a bad surgery, and then we can still fix them up. So I'm going to go to Brad. Brad in Los Angeles, you've got low back pain. Tell me about it. How long has it been going on? This is Dr. Marc Darrow.
Hello, doctor. Actually, I've had a kind of a disc blowout. It not complete blowout, but a disc is hitting a nerve.
Yes.
Happened at work. And I've been having numbness in both legs for a couple months now.
Okay.
And waiting for doctors to do something. So I did have an epidural.
Yep.
That they suggested. I didn't like that much. It didn't help much either.
Okay.
Now they want to do surgery just to go in and cut the disc away from the nerve. It's pushed over pretty far, and my feet are still pretty numb.
Okay.
And those are the symptoms right now.
Do you know if you've had any weakness in your legs or your feet?
Years ago, I'm 65, so up to this point, I've always worked on my back balance boards and just
Sure.
really kept it going because I surf and I'm active like you are.
Okay.
And the weakness, years ago, I had this problem. It lasted a couple of weeks, and I did have some weakness then. Right now, I had a little bit a couple of weeks ago where I didn't really want to walk too much, but
Okay.
the weakness isn't too bad now. I haven't noticed it. It's more of the numbness.
Okay. Well, here's the big deal about that. If you're having weakness, then you need to get something done because that could be a nerve that's being crunched. And if a nerve is
Right.
impinged like that, it can permanently stay like that. So it's walking at the razor's edge because a lot of times people have these syndromes like you have and they go away. So 94% of those go away by themselves without ever talking to a doctor. And we certainly don't want to cut your back unless that's something that's necessary. And the question is, what is necessary? So I'd have to talk to you in depth and examine you and see what's happening. A lot of times these are referral patterns from the low back, what are called trigger points or referral patterns, acupuncture meridians. There's a lot of terms for that. And we'd have to see, what is going on. The fact that the epidural did not work is good news to me, because that means that it probably is not the nerve that's being impinged.
Okay.
If it was an epidural given in the proper area, which it probably was, where that disc material is, that would probably shrink up the area what's called the foramen, with the hole that the nerve goes through, and you probably would have gotten relief.
Well,
So
I got relief the first. It got worse, and then that night, it all really got better. And then the next day, it was pretty good. And then a day later, the numbness came back.
Yeah. So I don't know. It's equivocal to me what's going on with you. I'd have to examine you to give you more information. Right. And oftentimes doctors will do 3 epidurals, like once a week, once every 2 weeks, to make sure they get the actual spot. And you've only had one of them so far?
Yes.
Okay. So you may want to go back and try, a second epidural and see if that gets rid of it for you.
Okay. I didn't. They mentioned doing that, and I didn't like the feel of that much of the chemical in me.
Yeah,
but,
I understand that. I understand. Having a big steroid dose in your body is no fun. And a lot of people have things like adrenal failure because of
20
it.
Years ago, my neck. I'm sorry. Go ahead. I talked over you there. Sorry.
Well, I'm just saying steroids are not a great medicine to take anyway. But if it saves you from getting a surgery, that's a great thing, because a lot of the back surgeries don't work out. I get people all the time who come in after a failed back surgery, and often it's a back surgery they never should have had to begin with, because I've been able to fix them just injecting with platelets and or stem cells. It was, the surgery was done for the wrong reason. I'm not saying all of them are, of course they're not. But you don't want to be the guy that gets a surgery when you didn't need it and it makes you worse. After the failure of the surgery, there's usually another surgery with a fusion, and then you get these implantations with pain pumps and spinal, all these stimulators and things that, unfortunately, I get all the people it doesn't work, so obviously I think they don't work. They must work on a lot of people or they wouldn't keep doing them. But my point is that it's taken a risk by doing invasive procedures, and the work that I do is basically non-invasive. And if it applies to you and you're a good candidate. You were saying, Brad? I'm sorry.
Oh, well, that was my plan. I'm doing anything not to do a surgery. Never even had one before. So. Yeah,
the only thing is you have to be careful. You have to be careful if there is a nerve being impinged on, that that nerve doesn't quit on you forever. But if you're not having a foot drop and you're not weak, then you're probably in pretty good shape. But I don't know the answer until I examine you.
If you don't have a foot what?
A foot drop, where your foot drops and you catch your toes, or you're weak or something like that. Right. Did any of your doctors say you had any weakness in your legs?
No, it's been pretty strong. They've been testing that. And,
So the good news so far from what you're telling me, and by the way, I'm not your doctor, so don't listen to me. Right. This is just educational material. The good news from what I'm hearing is that the part of the nerve that's motor is not affected because you're still strong, and it may be the sensory part of the nerve. And again, it may not even be the nerve. It may just be referral patterns. But it's something that has to be ferreted out by examination to find out what's going on. And I don't trust MRIs or X-rays or CT scans. I like them to get information, but I trust my hands more than anything in doing the examination.
Yeah.
If you want to come in, make an appointment. The number is 800-300-9300. You can call the office now. That's 800-300-9300. If you want to watch me injecting backs, go to the website, which is www.lastemcells.com. There's a lot of videos of me doing injections. There are different parts of the body. Basically, I inject the entire body. I don't just do knees or hips or shoulders or backs. I do everything. And I've been doing this a long time, since about 1997. I was the guinea pig, as I always tell people, because it worked on me. I started injecting all my old sports injuries and healed them all up. So it's something that I still have to do once in a while when I tweak my body somewhere. I just injected my knee about 3 days ago. I'm already better, a lot better. And for me, I'm a quick healer with this stuff. Every place I've injected, I've done both my knees, my shoulders, my elbows. I've done my right wrist. I've had other people do my neck and back because I can't reach. And everything has healed on me. So I'm very grateful. And it's the big reason why I keep doing this work, because it works. And again, it's not going to work on everybody for a lot of reasons. And this is something important. You've got to be committed to the process. It's not a miracle. It just makes sense. We inject cells into your body, like platelets and stem cells, that actually stimulate healing and regeneration of tissue and rejuvenation. So it just makes sense. It's not a miracle. And the failures are usually with people that are overactive, where they don't listen to me. They cheat on me, and they'll go out and do their sport right afterwards. I had a guy, crazy. I did a guy's knees. He was overweight, which is terrible to begin with, because all the pressure on his belly goes down to the knees. So every extra pound on the belly is about 5 extra pounds on each knee biomechanically. So he was overweight, and he played a lot of golf. He was basically a very wealthy retired guy, and he just played golf. So he came in, I did both his knees. He came back 2 weeks later complaining it didn't work. And I said, well, did you play golf? Were you active? He goes, no. And his wife she was there, she rolled her eyes up and she said, honey, you frickin' played golf 3 times. And he goes, yeah, I did. And I said, don't expect to heal if you're going to beat up the work that I'm doing, right? It would be like doing a surgery and ripping open the stitches. So that's one reason. You got to chill, let it heal. Another reason is people don't do enough treatment. They come in and they get a treatment and they come back 2 weeks. I check people at 2 weeks usually. And they'll come back and go, I'm done. It didn't work. And I go, you need more. And they go, no, it should have worked. And I go, I told you when you walked in, it may take several treatments. I don't know. And that's kind of a hard thing for people, right? They want a quick fix. And growing tissue is not a quick fix. I've been very fortunate. Most things that I've injected in my body have healed very quickly. But I have had a couple areas that have taken months to heal, with several injections. So I never know the answer. People say, how long will it take? I go, I don't know. Another reason for failures on this stuff is doctors don't use an ultrasound to guide the needle. You've got to look inside the body if it's the knee joint, the shoulder joint, the hip joint, because the spot to get into is a micromillimeter. You need it's like a scope on a rifle. The ultrasound allows me to look inside the body. I don't need it to inject everything, but some things I do. So another reason could be that people are taking ibuprofen, an anti-inflammatory, or some other anti-inflammatory, which blocks the inflammation we need for the healing. I know that sounds crazy, but we need inflammation to heal. And then another reason people don't heal is they have what I'm going to call a bad doc. They get a guy who doesn't know what he's doing, hangs up a shingle after a weekend course, or comes in to do a lot of injections for a chiropractor or something and has no idea what they're doing, or a nurse practitioner who has no idea what they're doing. I'm not saying they're bad people. They might be great at what they do, but they may not know much about regenerative medicine. So if you're going to do this type of procedure, go to someone who does it all day, every day of the week, and ask them, how many of these did you do today? How many did you do yesterday? How many the day before? A lot of my buddies that do it do, maybe a couple of days a week. I've always told when I'm at national meetings, I do the most of anybody on the planet. I don't know if that's true or not, but I do a lot. I'm busy all day, every day. I love the work. It's exciting. It is fun watching people heal. And I love solving people's problems, with this type of medicine. It's a lot of fun. It's easy work for me. It's simple. And when I say it's easy work, go ahead. I'm sorry.
Oh, well, I mean, that's my thought on it. I don't want to do surgery. I'm really worried about this nerve. And I'd rather do it with the stem cells in some other way.
Sure. Well, one thing you've got to get done real quick, Brad, is you got to get an EMG and a nerve conduction study. And that'll give you a really good idea if it is a nerve impingement or not.
Okay. Well, I mean...
your doctor can order that for you, or I can order it for you. I don't do them, but we can send you to someone that does them.
Yeah, I'd love to come and see you. I was just saying the MRI does show a big impingement on the nerve, but...
You still got to get this study. Back in the day when I started doing medicine, everybody got an EMG and nerve conduction study, and everybody saw a psychologist. Okay? They don't do that today. I don't know why. They're quick to jump on the trigger. I don't know why. It's just the culture has changed quite a bit.
Yeah.
I send, if someone wants surgery, one of my patients, I make sure they get an EMG and a nerve conduction study. There was a neurosurgeon that did a lot of backs and necks years and years ago. I had him on my show, and he told us that he wouldn't operate anyone unless they came in 3 times with their family, because he tried to talk people out of surgeries because there were so many failures with the backs and necks.
Yeah. Well, those are the, I've had friends that had them too and aren't doing any better. So,
hey, listen, let me tell you the truth. I love doing surgery. I did a lot of it in my training. I'm not a board certified surgeon. And the reason is because I had a shoulder surgery that got miserable, failed terribly. My arm blew up and I love the surgeon, by the way. He was my boss, my professor. Hang with us. We're going to go to a break, Brad, and then we're going to finish up the stories about you and what's going on with your nerve potential impingement and your numb legs. So anyone want to call me now live, 866-870-5752. I'd love to talk to you. Thank you, Nita Valens.
You're welcome. You're listening to Living Pain-Free with Dr. Marc Darrow. And I'm your host, Nita Valens. We'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.